We're talking about people who have transgenerational trauma, and coming from my perspective, I am a trauma therapist, and so that's the lens that I really come from a lot of times, and so that's kind of where I'm looking from when it comes to serving the populations that I do serve. I really like to focus in on more BIPOC individuals, so I really love working with Black, Indigenous, and other people of color. I also recognize I have a massive amount of privilege, and so I kind of made it a mission of mine to use my privilege in a way of being able to help the more underserved communities. Cognitive behavioral therapy is supposed to be really popular and it's really evidence-based. However, a lot of the research has been done amongst white populations. And so it's about figuring out what are going to be the research methods and the approaches that are going to work best for people who have other identities. There's not a lot of awareness about mental health in these communities. There's a lot of stigma, there's a lot of shame. Some people don't want to get help or receive help because it can be seen as a disgrace to their family. They can be thought of as like local or crazy. And so that can bring a lot of internal conflicts for folks when it comes to just trying to, work out, if they need help and how to get that.
By definition, all refugees have experienced trauma, but it's unlikely that mental health has never been addressed or any resources have been provided to them to help them on the journey. So on the way, they just find their own coping mechanism or just create their own skills without the help of a professional. But I work closely with the Ethiopian and Eritrean community. We just help them resettle and navigate the healthcare system in Columbus and serve them so they don't walk alone. Everything that we do is in a circle. We eat in a circle with a group of people. We make coffee in a circle in a group of people. We talk and do some games in a group of people. But when you move here to Western culture, you can do whatever in different places. So that circle breaks out and they're not used to that environment. We try to bring food and culture around them to help their senses be familiar and open up and tell us what exactly they want, because we want them to feel accepted and to have a free environment to express what's going on in their life. The housing system, the education system, the medical care system is very, very different. They're just totally confused and they need help to understand how to adapt to a new environment. So without addressing those primary issues, it's hard to navigate what mental health concerns they might have. I just want the community in general, especially community from Ethiopian and Eritrean community, to be able to be comfortable to have talk therapy or just get adapted to the Western culture of mental health interventions.
I serve all the new Americans, including Nepalese and East Africans from Ethiopia, Somalia, Kenya, and anyone who was born overseas. Mainly we do serve to the Somali community. Since I am from Somalia, I do speak the Cushitic language and the Bantu language, which is the Mai Mai language. Somali people came from 10,000 miles away, which is very far away from here. They've been through a lot of hardships and a lot of civil wars and all that. So I just wanted to say that, so many of them are stressed out, do have depressions, and all of them do have some of PTSD's signs. We're all same. We come from a long trip and long journey, and we wanted to make it here a home, a place where we can raise our kids and contribute to the quality of the United States of America. The need is really very, very large and very huge. What we did first was we started to do education and awareness among the community, since mental health is a taboo in our culture. Most Somalis believe that if you're mentally ill, it's reserved to the religion and to God, something that has to be done with God and the power of God. So what we did was, when we started this program, we had a contracts with the mosques to make sure that when people come to the mosque, they get the right message and they give them the right message. We've trained the imams here in the city of Central Ohio so that they can refer if they see anyone who is mentally ill. Last 2 years, we've been in pandemic, people have been in their houses, stress and depression become more. So that's what I said, let's make sure that and deliver this message, which is mental illness is as normal as a body illness.
Currently, I'm seeing a lot of people now who are dealing with symptoms of anxiety and depression, after going through COVID and also facing some of the trauma of what's been going on in the community as far as gun violence. people are more afraid now. In the African American community, one of the diagnoses that's really overused is schizophrenia, when really it's not schizophrenia, and they're least likely to be diagnosed with depression or anxiety or trauma. And a lot of times in the African American community, people suffer small traumas. Small traumas are like little mosquito bites, and you keep getting bit, and then it grows. So we may be anxious or depressed, but we're so used to always being on guard in a fight or flight mode that we don't know that there's another way. Unfortunately, in the African American community, especially when you're dealing with community help, most of people are forced to go into counseling, and it's not a choice. I think that I'm really hopeful, though, that some of the stigmas are dying out, and that people are finding therapists, or therapists are getting training so that they do understand and can relate to our community.
I think that people need to understand a lot of the mental health issues that the population that has allowed me to work with, they need grace. They need that human contact. They need humanity. The women that I primarily work with, because it's mostly women, I do work with children, youth, and transgender individual. They come to this place as victims of human trafficking, which it's what we call multifaceted trauma. We're working with thousands of people in our city that's affected by human trafficking. I'm already overwhelmed, and it's just February. and our numbers are there to prove. Even January, we already saw close to almost 200 people, here. Our approach is basically not only a harms reduction approach, is a compassionate approach through a nursing approach. As a nurse, I'm able to meet them where they're at, ground them with love, and let them know that they are amazing, that they're strong. If they have no hope, they're just gonna follow what they see is normal. And it breaks my heart because I see generational human trafficking. It's not surprising for me to see a mother, a daughter, and a grandkid here. I've seen it. The challenges are the mental health services are not available during our shift. I'm here at 10 o'clock or 9 o'clock at nighttime where these people are hurting. This is the time when people are exposed to violence. There is a remedy, and part of the remedy involves compassionate, caring settings.
The population that I work is in general for the Asian communities. I work for Bhutanese Nepali communities in central Ohio. We have a team called the Refugee and Immigrants Department in Ohio State University that is in the Cancer Research Center. So there, I have to connect many of the people with the healthcare needs to their doctors. I do a lot of community works, how to educate the community about different perspectives, not only health perspectives, about the social, spiritual, other different things, like how to be good men or good women in the community. And many of the time people do not express their problems. The other barriers, like people has got transportation barriers, people has got language barriers, people has got cultural barriers. People don't able to express their point where they have to express. The other service provider could not get chance to understand and feel their situation properly most of the time. We all need to work from different perspectives in a different way.
There is a connectivity simply in creating diversity. What is uniquely challenging, specifically for queer people of color, is being able to find providers that understand the unique intersection of the experience of what it looks like to be a person of color and also a queer person. It's sort of an impossibility to separate out the pieces of ourselves that are are we experiencing this because we are a person of color? Are we experiencing this because we're a queer person? Those pieces of us are interconnected, even in, the queer community until recently, right? The majority of the stories that, have been told have mostly been about, people that are not of color, like people that are in the majority of that minority group. And then also, I think as a queer person that's also a person of color, there's a piece of not feeling sometimes fully connected to that experience either. It creates this unique experience of being othered sometimes in the intersection of both your minority communities, right? So it's like, I don't feel fully a part of this community. I don't feel fully a part of this community. Where do I fit? And I think by providing virtual services, you sort of level the playing field. Telehealth is really, and virtual services is a really big part of how I address access. It also removes the barriers of transportation. It removes the barriers of a lack of support. You don't need somebody to take you to that appointment. I love being a person that maybe I wish I had had.
My journey with Mental Health America of Ohio, my journey with POEM, and my journey with RISE started just out of my own personal lived experience. I became pregnant unexpectedly during 2020. My anxiety was so severe. You wanna celebrate it, you wanna feel joy, but I really didn't. I felt a lot of fear. We know that when you connect with a peer, it destigmatizes some of those mental health concerns, right? So there's the level of trust and relatability when you talk to another mom or another birthing person about what you're going through. POEM, Perinatal Outreach Encouragement for Moms, we are a free, comprehensive mental health support for moms and birthing persons throughout the state. We have a branch of POEM called RISE, and that is exclusively for and by Black moms and birthing persons. We know that not only do Black moms and families experience higher mortality rates than their white peers, but Black moms and birthing persons also experience higher rates of perinatal mental health complications. So higher rates of stress, anxiety, depression, other mental health concerns, but yet are less likely to receive treatment and care. Racism trickles down to all aspects of your life, right? The income differences and disparities, where you live, your access to food and nutrition, your access to education, your access to insurance, and what does your coverage look like, which is related to income. Our main role is to be a single pathway for people to help eliminate the barrier. We just try to be someone who's rooting for them.